So an interprofessional practice is really probably the linchpin that holds everything together. The way you do that is by having a tightly integrated team. You have everything from support staff to scheduling staff to surgeons, audiologists, speech-language therapists, all in an integrated approach to bring a cohesive and holistic view of the patient care directly to every patient every time.
I love to cook. I've worked as a chef all my life, 50 plus years. I try to teach myself new things and how to make things. I wore 2 hearing aids for 20 some years. Hearing aids continuously broke down in the kitchen. The moisture and the smoke and the noise and the sweat and all that, I was having a hard time with it.
As you start to lose your hearing aids are often the right answer, but over time you have an inability to understand the words. It's more than just hearing the noise.
I happened to see Dr. Kaplan at GBMC. He said to me, he said, you know, you'd be a candidate for cochlear implant. I was really reluctant, and he said, just humor me, make an appointment and see what happens. The cochlear implant just opened a whole new world.
A cochlear implant actually restores the clarity of the sound, not just the volume.
Working in cochlear implants and certainly working as part of a team as we do here is so rewarding to see patients and watch their life change as they're able to enter a world of hearing again, connect with family, go back to school, be successful on the job.
Our interprofessional teamwork certainly benefits the patient in that we're able to connect with the appropriate professional in a timely manner so the patient has an answer as soon as possible and without the patient having to chase down that professional.
The audiology team at GBMC worked with me, helped me, get me through everything. The speech therapist helped me with the equipment and how to learn the language again, and it's just great team effort by all of them.
As broad as the team is, the more impactful it is for the person. So if I can work productively with the CI tech and the audiologist, that will help me to have informed care for the patient.
The bottom line is when they go home, they need to know, how do I turn this on and off? How do I charge it? How do I, hook it up to my computer? How does it work with my phone? I can take the time, go over everything, show them how everything works.
I can email them anytime, I can text them anytime. If I have an issue or a problem, I hear within a couple hours. They're always receptive to my questions, and they've just kind of really walked me through the whole process. It's been great.
A patient knows when they come in, have the team members been talking to each other? Are they on the same page? Are we having a flow of information so they're avoiding repetition? All of those things lead to a level of confidence in the patient that their care team is working together seamlessly to drive the best possible outcome.
My hearing now, once the cochlear implant came in, I discovered my music again. Playing the guitar is transcendent, takes me somewhere else, makes me remember the tunes where I first heard them. I can hear food. I can actually hear food sizzling in the pan. So that connection of me to my food is even closer now.
I would say it feels outstanding for all of the providers to be part of a high-functioning team, such as the one we have here at GBMC. At the end of the day, it matters that the patient has received the very best care and is now leading to the very best outcome. And if you can be part of a care team that delivers that, that makes a rewarding experience and a good place to go to work.
To be able to see patients and watch their life change as they're able to enter a world of hearing again, I don't think there's a better job in the world.
You gave me my hearing back, and that's a gift that I can't repay. Now I feel like I'm part of the world again.